this video, we are going to talk about the things that you need in your folder as a new grad who's going into skilled nursing facility, or as a fieldwork level 2 student who is going to a skilled nursing facility. So this will be useful for either or, okay? I find that when you do this, it makes you a lot more prepared for what is coming. And not only do you need to print this and put it in a folder or a binder, I think that the things that I'm going to talk about are really good foundation information for you to go over and make sure that you know, to help make sure that you are ready for your new setting. Okay, and you can definitely add on to this, like if there's anything that I didn't mention, anything that you come across, you can obviously add it on to your list. So you can definitely keep this binder or this folder. If you're a student, you can definitely keep this binder or folder for when you become a clinician, and if you ever want to go into skilled nursing facility. And yeah, so let's get it started. I feel like the first thing that you definitely need is you need to have the FIM levels, independent levels, functional independent measure. That's what FIM stand for. You need to have those levels in your folder. Okay, and I'm not going to expand on that. If you want me to make a video about FIM, I don't think I need to, because maybe I'll insert a link down below about what is FIM and what that entails. But if you guys honestly want me to make a video about it, I will make it for you guys. Like, you guys know I am here to help you all, so I wouldn't mind doing that. Okay, so let me know down below. So the second thing that you need in your folder is definitely your balance levels. You need to know what the levels are for sitting balance, and also what the levels are for standing balance. And not only do you need to have this list, but you also need to know the list, and you also need to know what it means. Okay, what does poor sitting balance mean from good sitting balance? You need to know that. Muscle strength. So you need to learn how to test the muscles and also learn how to grade the muscles. That's all I'm going to say about that, because that can go extensive as well. The next thing on my list is creating an evaluation template. I think that this is very, very important, and I find that this is very, very helpful. I wish it was something that I did as a new clinician and also as a fieldwork level 2 student, because that would have helped me with my evaluation a lot better. And I find that a lot of people have this question about, like, how do I do my evals? How do I make it more effective? And I think this is one way to do it. If you can make a template, like literally go on Word document or go on Google Forms and create your own evaluation template for yourself. So what happens is that a lot of the rehab optimists and the Kasambas, they do have a template that is embedded in that program, as far as that, like your evals and what it means and things like that. But I think that having a template will also help you, because you can practice when you are home, for example, if you wanted to practice different things. And you can also build your own template, right? You can make sure that it has things, because there's certain questions that the template that Rehab Optima has or Kasamba has may not have some of the questions that you may want to ask. That's why I love creating my own template. And then once I fill in the information, I can then transfer it on the computer. But even if you have a template, you don't have to fill it out. It can literally be like a piece of paper with just questions to ask, to make sure that you ask each of those questions. So you can also build your template based with some of the things from Kasamba or Rehab Optima. Build that using that information to build your own template and add your own thing to it. You can also watch what your CI is doing and then get some things from there, as well as as far as what to add on your evaluation template. But if you guys, I'm probably gonna post another I'm probably going to do another post. I don't know if I'll make a video. Maybe I will make a video too. But I'll definitely do another post on Instagram about, like, give you guys an example of what my personal evaluation template may look like. Okay, the next thing that you need to have some kind of note about is vital signs. This is very important. You need to know what is normal versus what is not when it comes to heart rate, when it comes to oxygen saturation levels. Blood pressure levels is another one that you need to know as well. That is very, very important. Okay, so make sure you know what the numbers are. Make sure you know what's normal, what's not. Make sure you know how to check that too. So if you need to order like a pulse ox from Amazon, I can leave a link below, the one that I used. You definitely need to learn how to use a blood pressure cuff, learn how to use a pulse ox and how to read it and things like that. It will just make things a lot smoother. You need to know what the common precautions are. So precautions for hip precautions, back precautions, sternum precautions, those are like my top 3 that you must know, because you will treat people with sternum precautions, you will treat people with hip fractures, you will treat people with back surgery. Okay, so you must know those 3 for a fact. Okay, then of course there's other precautions or other contraindications based on if your patient just had hand surgery done. Okay, they had a fracture, they had surgery done, and you're over there trying to get them to do strengthening. That's a no-no. You're not supposed to be doing strengthening straight ahead, especially if this is a new onset. But you can sometimes get that information from the doctor. If you are ever confused if you should do strengthening or not, ask the doctor. Okay, that's another video that I can make, right? Precautions, different precautions, and how to go about that. So let me know if you guys want that as well. This video is giving me a lot of ideas. So contraindications, like I already mentioned, you need to know that. You need to have a list of that as well, especially when it comes to modalities and when to use heat, for example, versus when to use cold. I think that is important information that you need to know, because you may or may not be working with modalities as a student, but I know as a clinician, depending on your state, you may be using heat and cold straight right away, so you need to learn how to use that. And then it can go much in depth when you talk about e-stims and you talk about diathermy and you talk about ultrasound. That can also have its own contraindications on when and who can use it and things like that. So make sure that you at least know the general information about that. But that's another video that I can make, isn't it? All right, the next thing on my list is commonly used assessments. Okay, you need to have at least 1 copy of each assessment in your folder or your binder. And then 1 copy is fine. And the reason why I say 1 copy, and then you can take like a highlighter and just, that's what I used to do. I'll print 1 copy and I'll just put like an X or like a straight line through it, and I'll use that as my main copy or thing to then make a lot of copies if needed. So that would be like my, what is the word called for that? I don't remember, but yeah, that will be there for you to use. Okay, so the assessment that I think is important in this setting is definitely the Bartel Index assessment. Okay, the MOCA, the mini mental, the role checklist. I didn't use the role checklist too much, but I've used it before. The Berg balance scale, the Berg, the DASH, and the visual pain scale. All of these are really, really great assessments that I think that are great to have in your folder. Okay. All right. The next thing on my list, number 9, is the list of common diagnoses. And it's not just about having the list of the common diagnoses, but you also need to know their symptoms. Okay. So this diagnosis that I'm going to mention, you need to know them at the back of your hand. You need to know what they are. You need to know what it is, what are the symptoms, what it may look like on your patient, because disclaimer, every patient may present differently even if they have the same diagnosis. Some patients may also have comorbidities that can make the patient present a lot differently, or other factors that can make them present differently. And so know it, right? Know the general symptoms, know what it may look like, and I'll give you the next tip in the next tip. But anyway, ortho-related diagnosis, so like fractures and replacements, so hand fractures, different hand fractures and hip replacements and things like that. You need to know back surgeries, things like that. You need to know them, okay? Spinal cord injury, TBI, dementia, mental health related diagnosis, so schizophrenia, bipolar. Patients with schizophrenia, I saw a lot. Patients with bipolar, I think those were my top 2 that I saw a lot of. HIV, I saw a lot of patients with HIV for sure, MS, Parkinson's, stroke for sure, heart-related illnesses or surgery, pulmonary related illnesses, and alcohol related illnesses. Those are like my top diagnosis when it comes, or the most common diagnosis that I saw frequently as an OT in a skilled nursing facility. Of course, this is just a common diagnosis. You may see people with other diagnoses that may not be on the list. Oh, another thing that I did see a lot is definitely patients with morbid obesity diagnosis. I saw that a lot. A lot of patients with diabetes. That's also another big one that I saw a lot of. So just keep that in mind. Lymphedema can also be, that can also be added to the list for sure. All right, the next one on my list, and then this is the final one, is make sure, and I think this is the most important one, honestly, is to make sure that you have a treatment blueprint idea for all the diagnoses that I just mentioned, and maybe even more. And I say blueprint idea, meaning that if you started your placement tomorrow, or you started your job in a skilled nursing facility tomorrow, and you are presented with a patient with any of the diagnoses that I just mentioned, are you going to be able to, for the first session, are you going to be able to come up with a treatment idea right there and then? But I will also say this is going to be a general treatment idea because every patient presents differently, okay? And so, of course, this is going to be a little tricky, but at least if you know what the diagnosis is, you know what kind of treatment you can do with the diagnosis, it's going to help you be more prepared for it. So like, for example, stroke, right? We all know that if a person have stroke, and if they do have that hemiplegia diagnosis, meaning that one side is heavily affected, then you know that you should do something like maybe sit and balance activities, okay? Maybe reaching over with the good hand on the other side, reaching for things so the person can know that the other side, the left side, is still there, especially if they have neglect. They say they had neglect of this side, making sure that they're reaching on that side. Most of the time it comes to balance issues, so working on their sit and balance, working on doing hand over hand activities of reaching with both hands, okay, so we can get some movement coming. Doing some electrical stimulation on that hand. Maybe showing them how to dress with one hand, the hemi-dressing technique. So that's what I mean by have a blueprint idea of the different diagnoses, because obviously every patient is going to present differently, and then you can modify and adapt as needed to that specific patient. But you already be ready because you have your blueprint treatment ideas ready to go. So I think that would make it a lot easier. To treat your patient for sure. So I do offer one-on-one consultation services. If you guys need that, definitely hit me up and let me know. We can schedule an appointment for you. I usually do 1 hour to really talk to you about what is going on, to really problem solve with you and try to give you the help that you need. So if you're interested in that service, definitely go ahead and send me an email, DM me on Instagram, and I'll give you all the information needed. I'll also add it below in this video. So that is the end of the video. If this was super helpful to you guys, make sure that you go ahead and hit a thumbs up. Let me know anything that you want me to talk about even more. Thank you so much for watching and tuning in, and I will see you in the next video. Thank you guys so very much. I appreciate all the love and the support from the bottom of my heart. I'll see you in the next video. Bye guys.